perspective presented by the New Orleans Secular Humanist Association, following a few principles of humanism.
We're committed to the use of science and reason for understanding the universe and for solving human problems. We're skeptical of untested claims of knowledge, but we're open to new ideas.
We are concerned with securing justice and fairness in society and in ending intolerance and discrimination. We are committed to the total separation of religion and government.
We affirm humanism as a realistic alternative to the theologies of despair and the ideologies of violence. We reject the concept of an afterlife and believe in living a full and rewarding life here and now.
We value and respect each individual's right to judge and lead their lives according to their own position, as long as it's respectful of other people living in a free society.
We hope you enjoy today's program and others in the weeks to follow. Greetings from New Orleans Humanists. We have a very interesting show lined up for you today. A couple of months ago, I read in Gambit newspaper a rather lengthy article. It says here, a local doctor who founded WHIV-FM, a new radio station, says he wants to provide a home for the liberal media. Well, thank you for at least giving us a chance to be heard, because most of what I hear on radio and a great deal of what I see on TV is not the liberal side of media. It's the conservatives. This doctor is Dr. Mark Allen Derry. It says he's an infectious disease doctor and a social justice activist. Well, I'm happy to know about a social justice activist. And he says that the programming on this new radio station is going to be dedicated to human rights and social justice. Well, Dr. Derry could not make it to be our guest today, but we have we're very pleased to have as his replacement Mr. Edward Carlson, and he is with Odyssey House, Louisiana, as well as his connection with WHIV Radio. Mm-hmm. So tell us more about what the station is going to do and your particular connection to it.
Sure. Well, the whole idea, and as I was talking a little bit earlier, Dr. Derry came to me, and he's been a good friend of mine for many, many years. And he had came to me, and Mark Allen is always, I'll just call him Mark Allen, as he likes to be called. Mark Allen is always looking at trying to create and do different new things. And he created this little nonprofit called NOCIDA, New Orleans Society for Infectious Disease Awareness. And part of what his creation of NOCIDA was about helping to make people more aware around HIV and AIDS. And he would host little music events here and there, and he travels quite a bit, working for Tulane University as a professor in their infectious disease department, as well as being a doctor focusing on infectious disease. He's a teacher. He works at a lot of different clinics. He does a lot of different things. But he had, as I had talked about a little bit earlier, was that he had come to me, and he decided out of the blue to apply for a radio frequency. The FCC gave away about 1,000 frequencies about a year ago. They put out a bid for them, and they were low-powered FM radio, primarily for community radio. And there were, to my knowledge, there were 3 that were awarded here in the New Orleans area. One to Delgado, another one to a Vietnamese group, and then to NOCIDA. And so Mark Allen, who's a very smart, ingenious guy, he calls me, he goes, "Ed, I got good news and bad news. Good news is I applied and I got a radio station. The bad news is I applied and I got a radio station." So he didn't know what to do in terms of how to get the radio station open and operational. I'm as the CEO of Odyssey House. We're a rather large organization that provides drug and alcohol treatment services, and we do a lot of work, specifically a lot of work with HIV and AIDS, and we're very interested in a lot of issues around social justice and human rights, especially for our clientele and our population that we work with. So my board decided that we would actually, Nocita would come under the umbrella of Odyssey House, and we invested the money to get the radio station open and running and operational for World's AIDS Day, December the 1st. So we are now open and operational. We're at 102.3 FM. And we are working on getting online video streaming. Hopefully within the next couple of weeks, you'll be able to get us online and also on your phone.
All right. But your radio station is operating 24
Yes, it is.
hours a day.
24 hours a day, 7 days a week.
Now, he did indicate that he hopes in the near future to have locally produced shows.
Correct.
But at the moment, mostly you're bringing in shows from outside.
Yeah, so what we have been doing is things are sort of developing organically right now. Our first step was to get it open. Our next step is we're hiring a radio station manager, someone to manage sort of day-to-day operations. Then what we're going to be doing is we've created a committee of people from the community, from all kinds of backgrounds, that are going to review proposals from the community of people that want to have a radio show. Mm-hmm. And so our goal would be to have a radio show, talk radio, Monday through Friday, from 8 to 6 to 7, and then the rest of the time would be we would be hosting local music.
All right. Now let me just ask you this.
Sure.
The call letters, WHIV,
mm-hmm.
could turn some people off,
mm-hmm.
but what Dr. Derry said was that he wants to desensitize HIV,
mm-hmm.
because it's scary to a lot of people.
Correct.
And he says if that's in our name, they're going to hear HIV every 15 minutes.
Right.
And so he wants to desensitize the word, which is laudable.
Correct.
And from my organization's point of view, I have been trying to desensitize the word atheist.
Right.
Because that scares people.
Mm-hmm.
It doesn't mean anything. It just
right.
means that you're not religious. All
right.
right. But the word needs
right.
needs some desensitizing, just like HIV.
Correct.
So I guess if people get across over any rejection to the concept of HIV as a radio station, and they see that the programs are about many other things,
sure,
you can build up a clientele over time.
Exactly.
All right. Well, now tell me what your various organizations that seem to be sort of intertwined.
Mm-hmm.
Tell us more about those organizations.
So, you mean in relation to Nocita or Odyssey House, Louisiana?
Well, tell us about Odyssey House.
Well, Odyssey House, we're the largest drug and alcohol treatment program in the state of Louisiana. We do treat on average about 700 people a month. We are constantly expanding social services in the greater New Orleans area. We have a full continuum of care under our umbrella. We have a medical clinic, a free medical clinic for the community and for our clients. We have medically supported detox. We have short-term residential. We have long-term residential. We have a women and children's program. We also have case management services, and we do a lot of housing programs. We also have an adolescent residential treatment program, and we have an outpatient program.
Where do all of these programs take place?
Well, we have our main campus is located at 1125 North Tonti, but we have our detoxes in another location on Orleans, and near Orleans and Claiborne. We have our adolescent program is located on Washington Avenue, and then we have scattered housing around the area.
I presume there's no shortage of people who need your services. What sort of numbers of people do you regularly work with?
Well, so, as I mentioned, we see on average about 700 people a month, but what winds up happening is we often have long waiting lists for our programs and services. We could easily double the amount of services that we're doing.
Is your limitation finances?
It's funding, yes.
How do you get your funding?
We get our funding through federal and state funding. Is 98% of our funding. So we get we bill Medicaid, and the rest of it comes from state general fund dollars or from specific grants from the federal government.
But you need more in order to accommodate the need out there?
Correct.
Do you get private donations? Or?
Some. We're not a very, drug addiction is not a very sexy thing that people will donate to.
Yeah.
Just like with HIV and like you had talked about the word atheist, addiction. If I'm at a group or I'm talking to people and they ask me what I do, sometimes people sort of get like, oh, you work with those people, because, addicts and alcoholics are not really the prettiest people in our society.
Well, what sort of success rate do you have with the various people whose lives you're trying to improve?
Well, right now we have a graduation rate which is better than the national average, which is like about 48%.
When you say graduation from?
Complete treatment.
Okay.
So about 57% of our clients actually who start treatment complete it within a period of time.
All right. Now, do some of these then backslide and have to be treated again?
But of those 56%, we have tracked them a year later, and we've had as high as 90% of them still being clean and sober and working and being productive members of society.
Well, that's terrific. Now, are you able to find jobs for people who are recovering whatever?
Well, we believe we've done nothing for our clients who go through our residential treatment program if we don't find them a job and a stable place to live. So that's our goal for everybody who completes the program.
I see. Well, jobs are not really plentiful in New Orleans, are they?
They're not, but we seem to be, we have alliances with a lot of different groups. We have case management services. We do a lot of work with, we also have a prisoner reentry program, which opens up a lot of avenues. And we actually work really hard at finding people good, well-paying jobs, getting them out. Sometimes they have to start at one level, and we explain to them, you're just starting. Sometimes you have to crawl, walk, and then run. And so sometimes you got to start off here and then build up to go to the next level of where you need to go.
Now, in your multiple organizations, I presume you have paid staff.
Yes.
How many employees
We have about 150
do you have?
employees.
Oh, really?
Yeah.
How do you fit them into your quarters?
Well, we have a lot of space. I mean, we're pretty big as an organization. We have an
Okay.
annual budget of about $9 million a year.
Oh, well, if you say $1 million fast, it doesn't sound like a lot of money.
No, it doesn't.
Well, why does the general public, are they aware of your organization and the things you're doing? I'll have to say, I was not aware of all of this.
Well, I think the thing is with Odyssey House, we just really focus on providing the work and the service. We get most of our funneling through various different channels, hospitals, the criminal justice system, and the word on the street. So we're able to find people pretty quickly and getting people into services. But we tend to be quiet. We just tend to be more of a quiet organization. We just focus on providing our services, and we try to, we just focus on providing our services.
Now, are there governmental agencies trying to do the same things that you're doing? Under
Governor Jindal, he has stopped doing more direct services for governmental, so he has sort of cut out a lot of those individual programs for mental health and substance abuse.
That doesn't surprise me.
Yeah, he didn't, but then he cut down the governmental programs, but didn't expand them as much into the community once he cut down the governmental side.
But there are some governmental programs doing some of what you do.
Correct.
You have any knowledge about their success rates?
I do not. I know Metropolitan Human Services District, they're our local governing district area that provides services here in the greater New Orleans area. Mm-hmm. They really focus on providing, and they manage some of our contracts from the state. They do some stuff themselves, but most of the stuff they contract out.
when you just said the greater New Orleans area, you're covering the greater, do you cover Orleans Parish or you go into Jefferson Parish?
We take people from anywhere in the state. About half of the people who come to us come from other parts of the state.
Oh, I see.
And the rest are from the greater New Orleans area. There's not a lot of services. And Odyssey House, we're really good at being able to provide sort of a combination of mental health, substance abuse, and primary care, a really integrated model. And so part of having that integrated model is what is really focusing on helping to provide better outcomes for our clients. So, but our feeling is if we can't treat them, no one else can. So we really focus on taking everybody who comes to our door, no matter how complicated they are.
Now, I don't want to totally ignore the radio station.
Sure, and we can jump back
Have
in.
you gotten any kind of feedback from a potential audience or an actual audience? What I'm sure you have no way to measure the size of your audience, but you're getting some response.
Yes, we are. We're getting responses from people on Facebook. We're also getting emails from people that are saying that they like what they're hearing. They want more of what they're hearing. We try to provide a good, honest, frank discussion about things. And we like to have people from, even though I would say that we're trying to be more of a liberal point of view, and giving our perspective, we also want to be open for anybody to be able. We've had conversations. We've had conservatives or even libertarians and we have really good discussions about it. As long as people, I think the thing is, as long as people are willing to look at facts and pay attention to the reality of things and being able to discuss things like that in a reasonable fashion. You know, if somebody wants to talk about how President Obama his birth certificate's not real, I don't really have a lot of time for all that, and nor will we on our radio station.
All right. Well, Dr. Deary says the waves of 102.3 WHIV will be open to anyone except religious and conservative fundamentalists whom Deary says already have a place on the radio. So if the religious fundamentalists came and said, we want to do a show, you would say thanks but no thanks?
Well, there's so many avenues for them right now. It would seem like why would they even want to be on? And the thing is they would have to be able to meet our criteria, and the criteria about openness, being able to look and listen to other people's perspectives. I mean, it isn't like we wouldn't necessarily have people like that as discussions on the show, but I can't see, there's so many religious conservative groups out there right now that have avenues for that. Why would they want to have another avenue?
Well, to
overtake, right?
Counter,
yes.
To counter the liberal views
Right.
that otherwise would be on your station.
Right.
Those people don't give up. They are fighters to get the world working the way they want it to work.
Right.
And that's why, when I read all of this about your radio station, I thought, well, hallelujah.
Well, and our real focus is, like I said, we're developing this committee, and the committee is going to be about giving a voice to the people who don't have a voice. And so clearly, the religious conservatives, they already have a place where they can have their voice.
Now tell me, it's a low frequency.
Right.
How far can it be heard?
So it covers partly, and just so people would be aware that we have some dead zones we're trying to figure out. It should technically be covering the greater New Orleans area. I can hear it out in Elmwood really well. I can't really seem to hear it very well uptown area where I live. I also don't seem to we're having some difficulties getting it across the river. So we're trying to figure out some of those issues, but we got our tower up and operational, and we think that we need to do some adjusting on our tower.
The reason I asked is because I asked a member of our organization to consider hosting a show, because I know you all would welcome us. And he got back to me and he said, I drove around. He said, I could not pick up the station in Jefferson Parish. And he named, it seemed to have been wherever he went, because he wanted to see how far reaching it was.
Sure.
He felt that it was pretty much restricted, but you're working on on those spots that
We're
are
working
not.
on the dead zones, and there are a few of them. And so, and we've been getting feedback from people in the community about it, which has been very helpful. And so if, like, for example, if he were to send me an email to let me know what areas that he's not hearing the station very well, some areas it's staticky, some areas it's very clear, and some areas you can't hear it at all.
Okay, but you're working on all of that.
Yes.
And I would not say that we are not going to contemplate
Sure.
doing a secular humanist show, which I understand that it may be 3 days a week or whatever, but that's a lot of work.
It is a lot of work.
All right. Well, then tell me whatever right now you would like to say, either about the radio station and your plans there, or about your other organizations, and what you're looking for in the future, of maybe some new enterprises or whatever.
I think sort of the thing that kind of excites me about WHIV and sort of the combination connecting with Odyssey House overall is what it does is it actually sort of combines, this whole idea of public health and media, which can have such a powerful impact. I don't know if you're aware of this, but HIV and AIDS, we're number 5 in the nation per capita in New Orleans.
New Orleans is number 5.
We're number 3. We're in the top 5.
Oh, we are number 3 in the
Baton
nation.
Rouge is number 2.
As a city.
As a city.
As a state, we're
As a
what?
city.
We're what? Number 1?
Yeah, probably. The Center for Disease Control tends to measure things by cities because it tends to be more concentrated as a public health issue. So they measure it by cities. And so per capita in New Orleans, and actually where the radio station is located, Odyssey House is located, we're considered ground zero in the zip code, having some of the highest concentrations of HIV and AIDS.
And what you're doing is getting new cases all the time.
All the time.
Now, are these new cases primarily in the gay community? Are they heterosexual cases, or
we know that most people get HIV and AIDS 2 ways: one through unprotected sex and men who have sex with men, also through sharing needles, intravenous drug use. And so we get a lot of people with HIV and AIDS at Odyssey House. We have a large epidemic of heroin use and injection heroin use in the greater New Orleans area. So this is what's partly causing a lot of our problems. We also have we have a really alarming high rate of adolescents who are coming up HIV positive.
Is it because they don't know how to protect themselves, or they just don't care?
I think it is the fact that we don't teach safe sex education in our schools.
I wonder why we don't do that.
Because we're not supposed to have sex, according to the state of Louisiana.
Well, according to the state, we're supposed to teach abstinence, which is ridiculous.
It is ridiculous. Well, and let's just say that this is an outcome, is that what we're doing is we're putting our kids at risk.
And the young people that are getting AIDS, is it because can't be because they don't know about condoms? They just, what do they figure that it's not going to happen to them, or they don't care?
I think it's sort of a combination. It's kind of ignorance, because I think the studies show that if it's reinforced sex education, not only at schools but then at home, you get better outcomes for kids overall. And I can guarantee you, the kids who are getting HIV and AIDS, it's not because they're having sex with each other, it's because they're having sex with adults who are talking them into not having to have sex or use condoms.
The adults are doing that?
Yes.
Why would they do that?
Because they want to have sex.
Well, I mean, why don't they want to use a condom?
Well, because they're, for whatever reason, people don't use condoms, don't like to use condoms.
Well, if it saves your life, that's hard for me to understand.
But if you're not aware of that, right? So, I mean, we teach about safe sex and sex education to our adult clients who go to Odyssey House, and a lot of people, because especially when people are drinking or using, one of the first things that goes out of the window is reasoning and logic. And so you might be thinking, I should use a condom, but this person seems okay, so and they don't really want to use it, so.
I presume your radio station is going to do a lot of sex education.
Yes, and partly what we're going to focus on is the Our first show that we will be rolling out will be around HIV, because we are WHIV, and we are looking at trying to reduce the stigma associated with HIV and AIDS.
Yes.
And people are very interested in that sort of idea and trying to educate people about what are the ways to, avoid having AIDS. And if you do have HIV and AIDS, how do you keep from giving it to other people?
If you care about whether you give it to other people.
Right.
Some people don't care.
That's true.
Well, all right. We have a few minutes left. What else can you tell us about what we can expect in the future?
Well, I think some of the things that we can expect in the future here is we're going to have some really good dynamic programming. You can like us on Facebook. You can also look for us online, and we will be having the ability to be able to stream through the internet. So you'll be able to listen to us online, which will make it easier, or on your phone shortly within the next few weeks.
Now tell us how they see you on these various media.
So you can find us in Facebook. We're WHIV 102.3 FM, and we're WHIVFM.org.
Okay. Say that twice so people might want to write it down.
Sure. So WHIV, you could Google us, or WHIVFM.org, or you can also look at us at WHIV 102.3 on Facebook.
On Facebook, and the other one is
on the internet, on our website. And on our website, we will also be hosting and talking about a lot of different things, specifically in relation to how people can put out to be able to do programming on the radio station. So there'll be a process. There'll be a form. Our goal is that there will be a form that people will download. They'll fill it out. Then what they'll do is they'll come in and they'll do sort of a little pilot. We have a little production studio in our station, and then that pilot with your form will go to the committee, and the committee will listen and review and see how it sort of fits into some of our overall goal, especially about giving a voice to the people who don't have a voice.
And you have that committee set up, or that's something for the future?
We have several members of the committee. We're finalizing the committee right now, and like I said, our biggest thing is getting a full-time manager on board,
which is happening.
Starts on the 19th, and we're very happy when he comes on board.
Well, I'm sure that you will be. In the meantime, you seem to be carrying some of the weight.
Yes. Me and my staff, who, if you'd asked us 6 months ago how we'd be running a radio station, we would laugh at you. But now this is what we've done. We've learned a lot over the last 6 months.
If necessity can get you to do a lot of things you didn't know you could do.
It's very true. Very, very true.
Well, I think we are running out of time. And Edward Carlson, I want to thank you for being here.
Thank you very much for having me.
And I think we may want to talk again in the future.
Absolutely.
And we're looking forward to the station.
Yes, please listen in, and we're always open to feedback. So.
Okay. Well, we want to thank you folks for watching our show. We're here in New Orleans. But we also can be seen on YouTube and on our website of our organization, as well as on Vimeo. Thanks for being here.
All right.
We did it.